Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
For almost like 5 years, I've been having issues with my hips,
Okay.
especially the right side.
Sure.
It feels very stuck and very limited in mobility. I feel like this whole hip is twisted to the left.
So your pelvis is
Right,
twisted this way.
Right. So
Okay.
when I'm standing up straight,
Uh-huh.
I know for a fact that my hip is like minus this way.
Okay, so you feel also it's
And
your
then-
pelvis
right,
uneven?
Right.
Okay.
So since I'm like this way, I know I'm gonna walk. I feel that this right side is higher.
Higher than that
Right, higher
left
than the
side.
left side.
Okay.
Right. So when I feel the pressure on the ground more. I'm putting more pressure on the right and left.
So you feel one leg longer?
Right.
Because your pelvis is twisted, so elevated one
Yes, sir.
one
Yes.
side than the other.
And
How
also,
did you do that?
be honest with you, I do not know.
Okay.
It just happened.
Okay.
But one thing I'm suspecting is that I do a lot of golf swings
Okay.
like this.
Okay.
And so a lot of my motions are one-sided,
It twisted.
twisted,
Okay.
and then I'm using my hips
Okay.
like a lot, and
Okay.
then pushing it this way.
So you said 5 years, but you said you had back surgery. Is that happened? during
Yeah,
the same
actually,
time or
back
something like that?
surgery happened between 5-6 years ago,
Okay.
and after that,
So the back surgery was 5 years ago.
Right.
Okay.
about 5 years ago.
So how much tightness or pain in your hips from 0 to 10 at worst? And what motion caused the tightness?
In good days, I feel maybe a pain level of 3,
Okay.
and then I do have a lot of freedom, a lot of normal movements are okay.
Okay.
But when it's really bad, like days like right after when I work out
Mhm.
my legs or do a lot of walking,
Okay.
then I feel next day
Okay.
the kind of
From 0 to 10, how much?
about 6 or 7,
6 or 7. Okay.
and then I feel
Yeah.
the limitness
Okay.
right here.
Squat and tell me from 0 to 10 how much?
And from this side, I could start feeling it here.
Okay. How much from 0 to 10?
Maybe 5, 6 right now.
5, 6 where?
Oh, right here.
In the front and in the back?
Yeah, right here on the hip.
And the hip in the back.
Yeah.
Okay, 5, 6. And we just did one.
One, yeah.
One and you felt 5, 6.
Right.
Okay.
I definitely feel.
Because we're gonna do more than one afterward.
Right.
Okay? To really see how
Right.
you respond to that
Yes.
treatment. What other motion?
And then, as you can see from the front,
Yeah.
when I do this, my hip is this way. So,
To Van, as you see, actually, he's actually should be standing straight. His feet is
Yeah.
straight, but he was kind of like
right,
leaning this way.
right.
Okay, and visually, right on the top of the bone, right here, right here. Okay. Okay, and this is obviously you can see that one side is
Right.
is higher than the other side. Yep, and we can see that twisting,
Right.
even though your feet is actually flat, straight.
Right. Right. I mean, I was swinging it this way,
Okay.
but I'm limited here,
I
right?
can
So
see
it
that.
limits my swing to this
Yeah.
much.
So
okay?
that's gonna cause a shoulder issue because you're gonna compensate for
right.
the twisting
So, right. So
from your hip
right,
to the shoulder.
right. So other way that I'm right.
Oh,
So
How
right,
much?
About 7.
Let's just simulate that again because we're gonna use that.
So from here, so this way. This is the limit.
Okay.
Right. I mean, my right shoulder is not even here to the right side, right?
Yeah.
So
We really need to work on your mechanics.
right.
Yeah.
So that's why that's
Let's do a couple of swings
okay.
and tell me how much pain.
If I do it this way, about
Okay.
7, it's limited.
Okay.
Yeah, I can't push it this way
Okay.
because it's just blocked.
7. Okay. Pain free. So what kind of treatment you had before?
I had the physical therapy couple sessions,
Physical therapy. What else?
chiropractic sessions,
Okay.
massage therapy,
Okay.
a little bit of acupuncture.
So you had
Yeah, multiple different.
lift your legs up. So you had physical therapy, chiropractor, massage therapy, acupuncture.
Yeah.
So you had almost everything. Okay. So I can see the surgical side here. He had discectomy 5 years ago, and that's around the time that he started to have hip tightness 5, 6 years ago. I can feel some tightness in the fascia area. Fascia here. Okay.
Yeah, I do feel it.
Feel a little bit loud here. Okay. Make sure it's not painful. How's that?
It's not painful.
It's painful or not?
No, it's not.
Okay. You feel this knot here?
Yeah, I feel like I have a
A lot of scar tissue?
Yeah.
Yeah. And that's make a lot of sense because our muscle should act like a rubber band. When it contracts and relax, should stretch like this. So when you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contract, does not stretch much. And when that happens, it's actually because your muscle attached to your pelvis, so it doesn't stretch, so make your pelvis stuck
Right.
in that position and not allow it to rotate. So what we try to do is loosen up all the tightness so the pelvis will start to rotate normal motion.
Yeah, I mean, if you want to press it a little more, that's fine. I mean,
Yeah, I'm really going very deep here. That's
Yeah.
good.
yeah. A little more.
Too much?
No, no, no.
Oh, that's a big knot here in your calf. You feel this one?
Yeah.
Yeah.
I guess it's the whole right side is just,
Well, you have a lot of compensation for that.
uh-huh.
So I'm not surprised. Some patient after doing like having this issue for a long time, to start to have plantar fasciitis, ankle pain, foot pain, to compensate.
Yes.
Because you don't have a lot of mobility here, so the other
Oh.
motion will work harder to compensate for that.
Ah,
You know, it's like your car out of alignment.
okay.
Your tire's gonna worn out on one side more than the other side to compensate.
Ah, yeah,
You know,
okay.
so this our body works the same thing.
Ah,
That's why you start to say you have shoulder issue because you're not doing a lot of twisting in your trunk. You compensate with exerting force on your shoulder.
Yeah,
And I have a lot of patients like golfers that start to have issue like this. They feel the pain in the shoulder because they doing a bad body mechanics to compensate for the back limitation or the hip limitation. So we have to really look at the whole body mechanics, which one is not really doing the full rotation, which one is tight, because your pain could be the compensation area or the tight area or both. Typically, most of the time it's both the tight area and the compensatory joint. Yeah, definitely this is bigger knot than the one in the glute. You hear that? Hear that? Compensate a lot here. much?
No, no.
And you might see it here, the tool going over the scar tissue like a lump, like this, up, instead of going smooth like that. There you go. Not too bad here. Feel that bumpy here? Scar tissue here. That's from the surgery too. This
Yeah.
cut.
Yeah, this is appendix.
Appendix, okay.
Little kid.
So why I'm working on the front here? Because you had appendectomy, okay? So I feel the scar tissue here, and that tightness typically, most cases, either in the front or in the back, or combination of the front and the back. And I can feel here a lot of deep tightness here. So I'm gonna release that. I don't know if you can see the scar tissue from the appendectomy. It's right in here. So I'm gonna work on that. Is that too much? Did anyone work on the front here? The massage therapist, chiropractor, or acupuncture? Okay.
Yeah, I mean, chiropractor, they
Adjust your back.
just my back and my hips.
Yeah.
Things like that.
So the thing is, joint mobilization will never break scar tissue or release fascial restrictions. And joint never move by itself. It's usually the soft tissue that move it. That's why when someone corrected the alignment issue manually, and if you don't release the tightness that caused the malalignment, that's basically temporary fix. So the goal is actually loosen up everything so your joint get to normal alignment. And you can see the web of the scar tissue here. You have a lot of scar tissue here. You feel that bump here? Okay, here it's fine. A little bit in your IT band, but it's most likely here. Okay. Man, you get a lot of scar tissue in here, and that will pull your pelvis, and it restricts your range of motion in your hip. It's very thick scar tissue here.
Oh, yeah. Oh,
How's
that's
that?
better.
0 to 10?
0 to 10, maybe 3.
So from 7 to 3.
Yeah,
Okay,
0 to
that's
3.
good.
Yeah, I feel a little bit freedom on the tailbone.
The glute area
Glute
and
area.
ischial to prostate.
Yeah.
Okay, good.
Because I feel, before I feel that my muscles are glued to the bone. You know, like really
Shortening.
Yeah, yeah.
It's tight.
Oh, okay.
Yeah.
Okay, let me.
So now it's 3. Okay, let's do that twisting. How's that?
Okay, feels a lot better.
0 to 10?
Maybe a 3?
So 3 on
Yeah,
both.
both
Yeah,
sides,
in the
yeah.
same exact spot. Yeah.
Same exact spot, yeah. But
Um,
I still feel, yeah, I feel the tightness here now.
On the opposite side.
Yeah.
Well, when we release one side, if your both sides are tight,
And then
your
one was
brain
worse.
pick up the worst side and
One
ignore
side.
the other side.
Okay,
So when we release one side, you will start to compare now.
okay.
So that's
Because-
why you notice the other side is tight. It's not like look, it's just been tight before, but you ignore it because there's
This was
more
worse.
tightness,
This was more painful, that's
more
why.
more
Yeah.
painful.
Yeah.
So yeah, and your scar tissue right on the bone. That's why you're saying it feels like the muscles stick to the bone.
Right.
Because the scar tissue, it's like adhesion that make things stuck together. It's like internal glue, prevent from free movement.
Okay.
It's actually our body feeling when you have any trauma. It's like the glue. That's what glue the tissues. The problem is when you start to heal, if you have too much glue in the way of everything and does not allow the tissue to move smoothly, you know, that's when you start to have issue. We need the scar tissue. That's part of our survival. Now let's see how that feel. 0 to 10.
Oh, wow. Yeah, I mean,
You're going down more, actually.
yeah, I am.
Yeah, that's good. How does it feel?
A lot better. I actually don't feel any pain.
Okay,
Yeah.
beautiful. Let's do 10.
Yeah.
Back and forth 10.
What do you mean?
10 squat down. Okay. And count.
2,
Good.
3.
So before we started, it was 1 and you start to feel 7 out of 10.
5,
Now we're actually doing 10 of them.
6, 7, 8, 9, 10.
Any issue or everything is
No,
okay?
no, I don't feel.
Let's do the twisting.
Right.
Suck your stomach in.
Yeah.
Make sure your head and your spine is the same
Yeah,
line.
yeah.
Okay. How's that?
A lot better,
Mhm.
actually.
You are moving your head now.
Yeah,
You're rotating.
yeah.
Your head was not rotating. Was
No.
with a piece of rock.
I know, it was like stuck. Right here.
Okay. 10 swings now. Let's do 10. That's look nicer than what we started with.
Yeah, oh, a lot better.
Let's do 10.
3. Wow.
How's that?
That was really good.
Yeah. So how do you feel? Like put your hand and see the alignment now. How's that?
Hey.
You look straight. Before
Yeah.
he was actually, his hip was like this,
Yeah.
standing like that,
Yeah.
like this. Now his natural position is straight because nothing is pulling without joint mobilization, because we're not forcing the joint. We just released the tight muscle, the scar tissue, the fascia restriction, and the joint get to normal alignment by itself.
I'm pre-based. Yeah, I'm happy with the progress. Yeah.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.